Loneliness has become a significant public health issue to the degree that the Surgeon General has declared it an epidemic. While there are many factors contributing to this trend, addiction and loneliness are closely linked and often mutually reinforcing. Treating addiction is a priority when addressing the loneliness epidemic. According to the 2021 National Survey on Drug Use and Health, 4 to 6.3 million people aged 12 or older had a substance use disorder in the past year. Addiction and loneliness often co-occur. Individuals with addiction often struggle to maintain social connections, and loneliness is a risk factor that drives the use of drugs and alcohol. Our healthcare system is in a position to address both addiction and loneliness simultaneously. Medical professionals need to ensure patients have access to addiction prevention and treatment resources when and where they need them. Life-saving medications are currently available and should be prescribed by qualified practitioners throughout the health system. Effective and evidence-based psychosocial and medical approaches to treating addiction exist, including activity scheduling and pro-social connectivity, and they improve both addiction and loneliness. The following 6 approaches increase the accessibility of addiction treatment for patients, regardless of the setting. Identify patients with SUD and other related conditions using validated screening and assessment tools. Medical professionals can intervene early to prevent and treat addiction and arrest loneliness from taking hold by identifying patients at risk for addiction and for loneliness. Know your referral network of addiction medicine specialists. This network is critical in helping patients access the specialized care they need to overcome addiction and loneliness. Foster a supportive, non-stigmatizing environment for your patients by giving attention to the spoken, printed, and implicit language present in our environments. Make evidence-based addiction treatment available to patients. The deadliest threat to patients is the treatment gap for addiction. All practitioners can treat addiction. Addiction pharmacotherapy saves lives. Clinicians should prescribe medication for addiction to patients with addiction. Prescribing medication for SUD is not more difficult than prescribing medications for other chronic diseases. Finally, physicians should consider becoming board-certified in addiction medicine. By acting now, we can make a difference in the lives of millions of people struggling with addiction and loneliness. Please refer to the article link in this post for additional tips and resources. If you have questions, please visit the American Society of Addiction Medicine website for more information.